do require a gynecologist opinion to either pluck out the hair or settle the infection.
Right.
So I think the most ideal, if see by profession, if somebody is a swimmer or is a swimsuit model, so she would probably would want need it to be completely clean shaven. So a bikini wax or a Brazilian wax may work good for them. But what things that they need to remember is that post the waxing, ideally the perineal skin should not be exposed to sun for at least a period of 48 hours because it's very open to UV radiation. Secondly, they are most prone to bacterial and vaginal infections, fungal infections in the next 40 to 48 hours because of freshly cut and shaven skin. And also there is a risk of bleeding that happens sometimes during the course and process of waxing. So this is some things that they need to take care of. Avoid even rigorous sex about 48 hours after they do the vaccine because that itself can also give rise to abrasions and bleeding.
Okay.
And if that is not very mandatory as per their profession, then I think the best thing to maintain or to keep perineal hygiene would be to just trim the hair, and that would be sufficient enough to maintain, it provides the benefits of the pubic hair being present there, at the same time the cleanliness.
Right. Okay. Another thing, a lot of women complain about irregular periods. So what is it that they can do about it?
See, irregular periods is a problem with nowadays. We face almost every alternate woman stepping into a gynaec OPD would complain of irregular periods. It is something which is very physiological, meaning that sometimes even girls who start getting their periods, the initial years of periods after menarche, which is the onset of menses, and also periods when they are waning out and getting into menopause, are the times when physiologically there are hormonal changes that happen in your menstrual cycle, and so they end up having irregular periods.
Okay.
But if these periods remain irregular or they persist for very long time, meaning that a normal delay of about periods coming in intervals of say between 21 to 35 days, both are considered as normal. So a woman could get periods every 21 days or every 35 days, and that could still be normal.
Right.
Okay. But if they do not get periods for like 2-3 months, or they require taking medications to actually end up getting their periods, then that is something that they need to evaluate, and they need to consult a gynecologist to check if there's something going wrong, whether they need to correct it hormonally or whether there is some other organic cause that is causing it.
Okay.
Yeah.
Okay. And what would you say are the causes and symptoms of PCOS? Because a lot of women suffer from that as well now.
Yeah.
So what is it that?
So basically, PCOD, what we mention as polycystic ovarian syndrome. So it's a multi-genetic disorder where it involves a lot of what exactly happens in the body is there is excess androgen produced by the ovaries and the adrenal glands, and this hyperandrogenism, meaning the more of the male hormone.
Okay.
Let me put it in that way. So hyperandrogenism meaning more of the male hormones functioning in the woman, and that gives rise to a lot of acne, a lot of hirsutism. They do not get periods on time. It also gives rise to anovulation, meaning absence of ovulation, so they do not get their periods at all.
Okay.
And coupled with that, there is an ultrasound finding, or the ultrasound image shows that there are multiple polycystic kind of a pattern seen on the ultrasound in the ovaries.
Okay.
Yeah, so that exactly is the PCOS.
Right.
Causes of PCOS, if you go by it, see basically a lot of PCOS has now come up because of the PCOS is very much related to the insulin resistance. So insulin is a hormone which usually plays a very important role in glucose metabolism in our body, and this insulin becomes resistant. The action, so the glucose doesn't respond to the action of insulin. Insulin is not able to act on glucose. Most of the glucose gets converted into fat.
Okay.
And then this insulin in turn tends to develop more of, convert the estrogens and helps estrogen getting converted to androgens. So then the symptoms become worse.
Okay.
So the main causes for these are lack of exercise, inappropriate eating, bad food choices, having more of a high carbohydrate caloric diet, and not adequately exercising through the day continuously. In addition to that, now with more and more stressful lives, so even adolescents in their even during their school days take a lot of stress, and there's a very minimal sport or physical activity that happens these days. So this tends to worsen and gives rise to more cases of PCOS.
So it's more about lifestyle.
Yes.
The lifestyle has given rise to a lot of more number of cases. Okay, but what is it like? What lifestyle changes can one make to prevent this?
So, as I said, you can start with the main treatment of PCOS is to change lifestyle. So, the gynecologist would probably initially give you a few months of oral contraceptive pills to, just regularize your menstrual cycles and help you feel better that, now you're getting your periods on time and things are working. But that actually is only a temporary measure, and the long-term effect is completely based on lifestyle. So, changing your diet, so basically eating low caloric index carbohydrates, reducing the carbohydrate content in your diet. Normally, the carbohydrate content in our balanced diet would mean just about 30 to 40%, and an additional 40% should be protein,
Yeah.
and only about 20% of fat. So, increase the carbohydrate content that we take in is a lot, so we need to cut down on that. In addition to that, avoid eating, avoid trying to fast or to suddenly lose weight. Women tend to, go on diets and fast for longer periods of time. But then the fasting state itself doesn't help because it puts the body into a state of starvation. So eat frequent smaller meals, but make the right food choices is like the main thing.
Right.
After that, also a little bit about, the meals should usually, your rest or your sleep should at least be about 1.5 to 2 hours post your meal. So not immediately going to bed after having a meal, not eating too late at night, not skipping breakfast in the morning. Ideally, breakfast should be the most important meal of the day. The lunch could be lighter, and then the dinner should be the lightest. Yeah. And the other thing that can be done is to add at least 30 to 45 minutes of exercise per day. It could be in the form of brisk walking, it could be yoga, it could be swimming, it could be cycling, it could just be skipping rope. That's all. But then it should be done on a routine basis and something that you can manage to continue throughout.
Yeah.
Yeah.
Okay. But people who suffer from PCOS, like to know, can it be reversed in any way, or?
Yes, so as I said, because it is more of a lifestyle change, so obviously if you change your lifestyle, a lot of PCOS cases get reversed, and the hormonal, it's just that they need to have patience because sometimes the PCOS takes about a year, maybe two also to respond and get completely reversed. And then what you have done, changes in your lifestyle, you need to stick by them through your life so that you don't go back to the same hormonal situation to create a PCOS again. Because in the future, PCOS has a very high risk of developing insulin resistance and thereafter diabetes. So early onset diabetes and obesity is the future of PCOS. So that's something that we want to avoid.
Okay. Thank you so much for telling us so much about PCOS. We have another question. Are vaginal washes necessary?
So see, vaginal washes are not mandatory. So vaginal washes are basically introduced to maintain or to bring back the vaginal pH. Normally, a lot of physiological conditions such as somebody who's postmenopausal, somebody who's just had an abortion, so post-abortion, somebody who's had prolonged bleeding and has been menstruating for 1 month, or somebody who's just recovering from a vaginal infection, the vaginal pH gets disturbed. And because this vaginal pH gets disturbed, a lot of bacteria or fungus get easy entry into the vagina, being an open passage. And so women post-infections, post-abortion experience a lot of vaginal dryness. That gives rise to a little bit of itch. And then, they become more and more frequent and they start having recurrent infections. So the vaginal washes are mainly to, maintain the vaginal pH. They are slightly milder in the soap form, so there is not too much of irritation to the skin that has already got sensitive. But it's not mandatory to use it. So you can use it at times when you feel that, you've been traveling a lot or there's been sudden changes of weather where you've traveled to different countries or different parts of the world and there's been a toss in the weather. So, your skin takes a toll for that. So including your perineal skin, you've been using public toilets or public washrooms for a very long time. And so these vaginal pH washes just help to maintain that pH. So they can be used intermittently on and off, but it's not mandatory to use them continuously.
Okay. Another thing is, how often should one visit a gynecologist?
Yeah, so good question. I would say every week, but no. No. So I think in adolescence, now with the increasing chances of obesity, increasing risk of PCOS, I would say that if you have irregular cycles during your adolescence, it's not a bad idea to visit a gynecologist at least one to make sure that everything is in the normal limits and you're not having anything abnormal that you're ignoring. Okay, so that one visit or two would at least open up, make sure that everything is going smoothly. Also, the adolescent group is the perfect time to deliver what is known as the cervical cancer. cancer vaccine.
Mhm.
So there's a vaccine which is available against cervical cancer, and
Mhm.
it is known to, if be very effective against the four strains of HPV virus, which is the human papilloma virus.
Mhm.
And this virus is known to be has been causatively related to almost 97% of cervical cancers. So
Okay.
the vaccine is the most effective if you take it prior to being sexually active, which would be the adolescent woman.
Okay.
So this is also the time and the opportunity that you could take the cervical cancer vaccine.
Mhm.
Thereafter, once the woman becomes sexually active, every 2 to 3 years, she should have at least one visit to a gynecologist.
Mhm.
One to check if at all there are any other complaints, whether there are any vaginal infections, and at the same time to get a routine pap smear test done.
Mhm.
A pap smear test is a screening test for cervical cancer, which is a very simple test, and it is just done on an outpatient basis. It doesn't require any admission, doesn't require any preparation. And so every 2 3 years, get that check done.
Mhm.
And thereafter, after the age of 40, I would suggest that every woman should have a health checkup done every 2 years, which should include a gynec checkup also.
Okay.
You don't want to land up at the age of 60 having surprises which you otherwise could have avoided.
Right. Right. Okay. Thank you so much for answering all our questions.
You're most welcome.
Yeah. We would like to end our session. If you have any tips that you would like to give our readers, viewers.
Yeah, so I would just say that womanhood is something that we should all enjoy. I know that most of the women these days are working, and that we have much more to offer these days rather than just the managing our whole home chores. So I would just suggest that we need to take one step foot forward, and take care of our own health, and make sure that we're doing the right things and not just following what our friends or our peers do. And I think a gynecologist could be a right person to help you out, even if there are not obvious problems, but just these small issues that you could get more insight into.
Right. Thank you so much for
Thank
joining
you.
us. Thank you for watching.